It's very common for Parkinson's disease patients to be diagnosed in their 60s and 70s. And in fact, we know that the most common risk factors are being male, although women also get Parkinson's disease, and age. And so if we're making people live longer, we're going to see more and more Parkinson. And so it's not shocking to see somebody in their mid-70s get diagnosed, but we shouldn't panic because it's a very livable disease. And we know from data from the largest outcome study of Parkinson's disease ever attempted, the Parkinson Outcome Project, we know that patients with Parkinson's and certain subtypes of Parkinson's will live 20, 30, 40 years. And so it can be a livable disease. The diagnosis of Parkinson's disease is actually not a bad diagnosis. There are lots of things that are far worse, and we know that it's quite livable. We have a dozen different medications. We know that exercise and different sorts of therapy, physical, occupational, speech and swallow therapy, make a huge difference for these patients, addressing both their motor and their non-motor symptoms. So depression, anxiety, sleep issues can make a difference and make this disease livable. So we have over a dozen medications. We've got surgical options, we've got pumps, and so we have to understand the individual symptoms for each patient with Parkinson, because they can be very different, to choose and select and personalize their therapy. And so we're now tailoring these regimens, and we always recommend that if available, you seek somebody at either a center of excellence or with some expertise in Parkinson's disease.